Welcome, everyone, to the ribbon-cutting ceremony celebrating the completion and collaboration of the Prince William County Regional Crisis Receiving Center Complex. Yes. I'm Lisa Madron with Prince William County, and with me to welcome you today is Colin LeClaire, the CEO of Connections Health Solutions, our partner and operator for the Crisis Receiving Center. Today is a moment of celebration and reflection. Each of you have played a role in bringing this vision to life. Please take a moment to breathe that in. This is a shared achievement built on collaboration, compassion, and commitment. We are deeply grateful for our partnership with Connections Health Solutions, whose proven model of care will now serve our community with dignity and hope. We are also grateful for our partnerships with the state, the support and the advocacy of our state delegation, Governor Youngkin, your support and commitment through your Right Help Right Now plan, and the Department of Behavioral Health and Developmental Services. Thank you for supporting in planning, funding, and fast-tracking the licensing process, which we are currently in. And Commissioner Smith, your direct engagement has been invaluable, and we're also very thankful to Kurt Gleason and the whole DBHDS team. We are also very thankful for our partnership with the Department of Medical Assistance Services and Director Roberts. Your work with CMS and the IMD waiver is essential in making this initiative sustainable. And certainly to our county board, who took the first step to move this initiative forward. Vice Chair Bailey, who has championed this initiative, along with our county leadership, our county exec, Christopher Shorter, and our deputy county executive, Elijah Johnson. Thank you for believing in this vision from the start and helping bring it to life. And to our incredible community services team and county teams, particularly FFM. I have watched your dedication every step of the way, from our construction and project management teams to our administrative and PR teams. You've carried the vision in your hearts and worked tirelessly to make it real. We are also thankful for our community partners, NAMI and Trillium, Voice, Potomac Health Foundation, the Lions Club, Centera, and UVA Health for standing with us and lifting this effort. This facility is impressive, but its purpose is even greater. It represents a new dawn for behavioral health in Prince William County and our region. We are committed to learning, growing, and serving better together. Colin, would you like to say a few words?
Thank you, Lisa. Hi, everyone. As Lisa shared, I'm Colin LeClaire, and I have the honor of serving as Connections CEO. I'm thrilled to be here with you all today to celebrate the opening of this fabulous center. It's been a long time in the making, and I'm so excited to see that we're so close to opening. I'd like to start by again recognizing some of the hard work and collaboration of so many who helped us bring this center to life. I'd like to thank the Greater Prince William County, the Virginia Department of Behavioral Health and Developmental Services, Region 2, which includes the Community Services Boards of Alexandria, Arlington, Fairfax, Prince William County, and Loudoun, whose advocacy for increasing behavioral health services over the past few years have helped Northern Virginia lead the way in meeting the needs of their communities. Governor Youngkin and the Commonwealth of Virginia, who passed the legislation that enabled us to build this world-class center and model of care. Special thanks also to Lisa Madron and all others on her team for their commitment to bringing this center to life. The many community advocates for their dedication and advocacy all along the way. All of our community partners, including first responders, community providers, and advocacy groups who supported us. And finally, our Connections team members, including the 200 local individuals who will be caring for this community at this crisis center starting in just a couple of weeks. Thank you all very, very much. I wanted to share a little bit about Connections for those who are not familiar with our work. Connections pioneered this approach to emergency psychiatry about 30 years ago to ensure that people in crisis get the care that they need quickly in the safest, least restrictive setting possible. Today, we've served over 700,000 patients in crisis, consistently delivering the best health outcomes of any crisis facility in the country, and have been named the gold standard of high acuity crisis care by SAMHSA. At the Prince William Crisis Receiving Facility, our multidisciplinary team of psychiatrists, nurses, therapists, behavioral health technicians, and peer support specialists will provide our nationally recognized model of care in a safe, open, and therapeutic environment for adults and youth over age 12. And the impact will be visible. This location is prepared to welcome and care for between 15 and 18,000 individuals each year. Our experience demonstrates that when you provide people with immediate access to well-trained, highly specialized multidisciplinary team in a center that is designed for behavioral health, not in an overwhelmed emergency room at a hospital, not in jail, which is too often the case, recovery is both possible and probable, and success rates are much higher. We look forward to demonstrating the incredible impact that this model of care will have in this community. But we can't do this alone. We recognize that it takes a village to serve these patients, so true to our name, the team at Connections looks forward to collaborating with other service providers, with families, with community stakeholders to connect our patients with the vast constellation of medical, behavioral, and social supports that are available to our patients in this community. We're honored to have been chosen to share the impact of the Connections model with this community and to continue to change how behavioral health care is delivered in Prince William County and the surrounding areas. So thank you again to all the stakeholders in this community who make Crisis Receiving Center and this care possible, and to our Connections team for living our mission and our values every day. Back to Lisa.
Thank you.
Thank you, Colin. I would now like to acknowledge the distinguished elected officials and some honored guests and partners who have joined us today. It is my intent to include everyone, but please forgive me if I miss you. From our Prince William County Board Chair, Deshandra Jefferson. Vice Chair Andrea Bailey of the Potomac District. Supervisor Victor Angry of Neabsco District. Supervisor Kenny Bodie of the Occoquan District, home of our facility. Supervisor Tom Gordy of the Brentsville District. Supervisor Yesli Vega of the Coles District. Governor Glenn Youngkin, 74th Governor of Virginia. Commissioner Nelson Smith of DBHDS. Delegate Ian Lovejoy. Kevin Brown, Mayor of the town of Occoquan. Monet Nickerson, Vice Mayor of Dumfries. Amy Ashworth, Commonwealth Attorney for Prince William County and the cities of Manassas and Manassas Park. Jacqueline Smith, Clerk of the Circuit Court. Representing the school board is Vice Chair Tracy Blake and Lori Williams. Superintendent of the Prince William County Schools, Dr. LaTanya McDade. Taraza Jenkins and Tanya James, attending for Congressman Eugene Venman. Irene Roberts, attending for Senator Tim Kaine. Colonel Jenny Colgate, Marine Corps Base Quantico. Elijah Johnson, Deputy County Executive for Health, Wellbeing, and Environmental Sustainability. John Littell, Chief of Staff for Governor Youngkin and former Secretary of Health and Human Resources. Cheryl Roberts, Director of DMAS. And Patrick Sowers, Chair of the Community Services Board. We appreciate the support of everyone in the audience today and are so glad you could make it. It is now my pleasure to introduce you to the Chair of the Prince William County Board of Supervisors, DeShonda Jefferson, who will now share some remarks. Please join me in giving the Chair Jefferson a warm welcome.
Good morning, everyone. Before I begin, I have a couple more people that I would like to acknowledge. Our friends from the city of Manassas, Mayor Michelle Davis Younger. I have Sonia Vasquez Luna and Tom Osina. As the chair of the Prince William Board of County Supervisors, I'm excited and delighted to welcome everyone here today. This has been a long time coming, and all the people who are on the stage with me have made it happen. So thank you very much. You are the reason why we are here today. Give them another round of applause. We are here today to celebrate progress and unity with and thanks to the county staff, partners, and advocates who championed this project from its earliest stages. Northern Virginia, Prince William County included, struggles with significant mental health and substance use issues. Our hospital emergency rooms are overburdened with limited psychiatric resources, long wait times, and inadequate community support. An over-reliance on law enforcement for mental health crises strains the police department's resources, and they lack the healthcare-based solutions needed. With limited immediate care options, without access to timely local support and comprehensive care, individuals often find themselves returning to crisis situations. This just doesn't work. It's unattainable. We need to think differently, as the saying goes, and so we are. As the CRC ribbon-cutting theme says, this is a new dawn, which symbolizes renewal, hope, and collaboration. It reflects how Prince William County and our partners have come together to strengthen behavioral health for our community. We cannot stress enough how much this facility and its services will mean for our community. The CRC complex represents a major investment in mental health and public safety, offering an alternative to emergency rooms and jails for individuals in behavioral health crisis. The CRC will be a safe and secure center offering immediate support during mental health challenges. The help here will include 24/7 care and interventions, a mobile crisis response team, a co-located Prince William County community services programs, such as integrated psychiatric care, peer support, and community resources, and a collaborative continuation of care with partnerships with local hospitals, healthcare providers, and community organizations to assure seamless support for individuals and their families. While this ribbon cutting celebrates the completion of the facility and the services it will provide, we are still working towards the official opening. I really want to thank everyone again who is out here today. And I really, again, want to thank the staff, our partners, and everyone who made this happen. Mental health for too long has been stigmatized, but we have to meet people where they're at. If we're going to care for our community and about our community, it is incumbent of us to care for the most vulnerable among us. I want to thank everyone again for being here and everyone for making this possible. And now it is my distinct honor to introduce my supervisor and the vice chair of the Board of County Supervisors, Andrea Bailey.
You know you've made it when the chair of the board says, my supervisor. I tell you. So, good morning. If you could only see what I see standing here, I'm overwhelmed. And I just want to thank the community, first of all, for turning out today for what is yours, the Crisis Receiving Center. Thank you from the bottom of my heart. I just said to the commissioner, it's cold out here. So I'm crying and I'm tearing from allergies at the same time. But we're going to get through this. God has given us a great day on today. Today marks a powerful moment in the life of our county, the official opening of the Prince William County Crisis Receiving Center. This is more than a ribbon cutting. It is a testament of what happens when compassion, commitment, and collaboration come together to serve the people. The center represents a promise that in Prince William County, no one will face a mental health crisis alone. It stands as a place of hope, safety, and dignity, where individuals can find care when they need it the most, day or night. Before I continue, I want to express my deepest gratitude to all who made this possible on this day, to our partners at the Virginia Department of Behavioral Health and Developmental Services, commonly known as DBHDS. It's a long, but we finally got it at the end of the day, and the Department of Medical Assistance Services, DMAS. Thank you for your leadership, your resources, and your unwavering commitment to improving the behavioral health care across Virginia. And to our family, our delegates, our state senators and federal representatives and offices who all are with us today. Your advocacy has been vital in assuring localities like ours have the tools to expand access to quality mental health services. I'm grateful for you. To our county exec, Mr. Christopher Shorter, our community service board, led by the one and only Lisa Madron, and her acting, Georgia Bachman, can't forget Georgia. Our law enforcement agencies who said we're in from the very beginning, and every member of our local government team, to our mayors, our vice mayors, to our superintendents, to our councilmen and women, thank you for your dedication, for your turning this vision into a reality. And also, yes, please, to our school board, who counted it not robbery to incorporate mental health as an essentiality as you do your work on the board. I'm grateful. Yes. To my fellow members of the Board of Supervisors, I am honored to serve alongside you. Together, we have proven that when we put people first, we can move from conversation and maybe a little argument every now and then, to action, from plans on paper to doors that open in real life. For me, this moment is very personal. I was raised in a family that believed deeply in community, where neighbors looked out for one another, where empathy was the rule, not the exception. My parents taught me that when one person is hurting, the entire neighborhood feels it. That upbringing shaped my belief that government's highest calling is to care, and that the health of a community is measured not by the wealth of the community, but by how it treats the vulnerable. Mental health challenges touch every family in every corner of our county, regardless of income, background, or circumstance. They are not issues that can be ignored or stigmatized, which is a word that we're going to get rid of on today. They require compassion, coordination, and courage, and today, this center becomes a cornerstone in that mission. The Crisis Receiving Center will reduce the strain on our emergency rooms, provide critical relief to our first responders, and most importantly, offer residents a space where they are met with understanding instead of judgment, with treatment instead of trauma. This is an investment not just in mental health, but in humanity. It reflects who we are and what our values are in this county. That access to care, safety, and dignity is not privileges to be earned, but promises to be kept. To every partner, advocate, clinician, and resident who helped bring this vision to life, thank you. Because of your work, we can now say that Prince William County has built not just a facility, but a foundation, one rooted in compassion, equity, and hope. As we cut this ribbon today, may we remember that we are not merely opening doors, we are opening possibilities for life. Excuse me. Possibilities for hearing, for connection, and for stronger, more compassionate here in Prince William County. And so I thank you, and may this center be a beacon of hope for generations to come. And lastly, I want to thank the one that puts up with me as I'm going through day by day, my wonderful husband, your state president of the NAACP, Cozy Bailey. Thank you, honey. Together, we've prayed for all of you and for this center. And so I thank you for his steadfastness. For my representative on the CESB board, Dr. Bill Carr, thank you. Thank you so much. I am overwhelmed today. I'm not going to take any more time, but I am honored to serve this community. And so, when we started this project, there were two wonderful gentlemen that secured me in their offices. They know who I'm talking about, and said, make it happen. And we've made it happen. So to Chief Littell, I love you. And to the next gentleman that I will present, who's my partner in promise, Commissioner Nelson Smith, the Commissioner of the Commonwealth for the Department of Behavioral Health and Developmental Services. Thank you for your community. Thank you for your service. Thank you for your promise. Thank you for believing. Ladies and gentlemen, Commissioner Nelson.
Good morning. Thank you, Supervisor Bailey. And to your husband, too. We won't hold it against him. He's a Marine. Former Army. Where is he? All right. Thank you. Thank you for your service. First of all, I'd like to address something you're going to hear a lot about is stigma. Stigma is interesting. It's a word that we all know is we want to break. But just I want to put in front of us, mental health care is health care, right? But it's very difficult. And those patients, when they go to hospitals, it's not something that you could put a Band-Aid on or give Tylenol or something like that. Their symptoms come out and it's not a runny nose. It could be aggression. It could be tears. It could be confusion. So this place that we're looking at right now is going to be filled with those individuals, but more importantly, these people that we see over here on the side who are going to be caring for those people that come through this door. Time is what heals and love. And so I just really, when we think about the stigma, it's nothing that a Band-Aid or pills can heal, but time and community. Now, I'll say Supervisor Bailey was very, very adamant and very good at what you do. She was very in our offices all the time to keep it in front of us. So you definitely had a good representative in this space. As I mentioned, this is going to be a doorway for families to find healing for not just adults, but adolescents. And also the family themselves. We can't forget the person suffering. Often, we forget about the families who are dealing with this too. So again, we're going to find resources here that connects those families to help them deal with some of these long-term illnesses. It's not just a one-and-done thing. This also is going to unburden law enforcement. We heard it from the very beginning. Governor Youngkin challenged us to get law enforcement back into the communities. So here they'll be able to bring them to a place for healing and go back to what they signed up to do, which is a tremendous feat. And then the continuum of care. As we mentioned, hospitals are bogged down right now with everyone going in, and our poor frontline staff in the emergency rooms cannot keep up. How many of you have been to an emergency room recently? It takes hours just to be seen for something small. Again, we're going to provide a pressure valve, for the emergency rooms. This could not be possible without all of you, the local leaders that were mentioned, the community that came together, the significant investments from the community, but also from the state level. And then I also want to thank our DBHDS team, incredibly passionate, Kurt Gleason, all the way down through the crisis division. And I already thanked the staff here. But this is the last time I think I'll be able to do this. First time I get to do this. I've never been able to do this publicly. But none of this would have been possible without the leadership of Governor Glenn Youngkin. And, sir, I just want to tell you, thank you for allowing me to serve, for trusting me to do this job. I want you to know this has been the biggest thing I've done in my entire life, to be able to serve Virginians at scale, to provide right help right now. It's been an unbelievable ride, and so thank you very much. Right Help Right Now has changed and saved lives, tens of thousands of individuals. I hear the stories all day long. And this was the center of your administration, your priority. And I charged the hill. So it has truly been an honor. So thank you, and I look forward to seeing this beautiful building. Final thing. The 74th Governor of Virginia, Governor Glenn Youngkin.
Well done. Commissioner, thank you. Well, good morning, everybody. I tell everybody it's like this in Prince William County every day. It's beautiful. In fact, I was just here yesterday. I was just here yesterday right up the road at Toto's Supermarket celebrating Hispanic Heritage Month, and I can't tell you how happy I am to be back again today. Back here today to celebrate, to cut a ribbon, and to mark one of the most major milestones in the transformation of behavioral health, not just in the Commonwealth of Virginia, but in the entire nation, the Crisis Receiving Center here. I have one statement that I want to reverberate in everyone's ears right now. If you are in crisis, come here to get the right help right now. Get it right now. Come here to this amazing facility where no matter what time it is, you can come here 24/7 and get the care that you need. Come here right now where there are 64 chairs and beds to serve 64 of our fellow Virginians, men, women, children, adolescents, formed in the image of God, to come here and get the help that they need. Come here to a place that can reduce burdens, a place where law enforcement officers can indeed hand over responsibility for Virginians that need help right now. Come here. Come here for a place that represents true collaboration, true partnership, and true vision. Come here to get the help that you need right here, right now. There are so many who have been thanked who need to be thanked. The lists are long because the collaboration has been enormous. I have to say the leadership here in Prince William County has been astoundingly effective. It's been compassionate, and it's been relentless. And that's what it needs. I have to say, I want to say to Supervisor Bailey, thank you. Thank you. Thank you. You were in my office, in my ear, in our lives. I'm telling you, you are a force of nature. But I will tell you, that force of nature is God-inspired. That force of nature goes to work for the men and women you serve. You are here for a reason, and I know that there is an overwhelming chorus right now saying, well done, good and faithful servant. Thank you, thank you, thank you. To the team who works with me every day, thank you. John Littell, when he was interviewing with me as Secretary of Health and Human Resources, I said, John, we are going to transform behavioral health care across the Commonwealth and of Virginia in a way that will truly impact lives for decades and decades. And he said to me, I've been waiting my whole life for this. John, thank you. Thank you for your leadership, and thank you for your service. Commissioner Smith, it takes a Green Beret to take a mountain. And this is a mountain that you've committed yourself to be part of a team that has worked relentlessly. Thank you. To Cheryl Roberts and our team at DMAS, you never wavered on what needed to be done. Let me tell you what this team has done. Normally, a facility like this will take 2 years plus to receive its license. 2 years plus while Virginians in need would be waiting. While lives would not have been saved, while law enforcement officers would continue to be detained and distracted, and while our great healthcare workers who can support people who need to be hired have not been. In this whole process, this facility will be open within 90 days of it needing to be open. My friends, that is remarkable, but that is what everyone here has done. I want to thank everyone in Prince William County. I'm looking at the rest of the Board of Supervisors. I am seeing all the folks at our Community Service Board. I'm seeing the folks that volunteer and do work. Thank you, thank you, thank you. This is what it takes. Colin, thank you for your leadership. We set out to do something that was remarkable. And we went around the nation to see what does best in class look at. Thank you for helping us not just set best in class, but lead the nation in a facility that will be the standard for serving Virginians. The work that's gone on in the Commonwealth of Virginia in a collaborative partnership way over the last now nearly 4 years has been exactly that. And finally, I want to thank our friends in the General Assembly. I want to thank all of them. This has been bipartisan. And I guess Ian Lovejoy is our representative of the General Assembly today. Ian, if you could stand up, on behalf of all Virginians, I want to thank you on behalf of our General Assembly for leading and serving. Thank you, thank you, thank you. This whole journey started with a basic, clear understanding that coming out of the pandemic, but also for years beforehand, our behavioral health system was absolutely overwhelmed. We were coming out of a pandemic, and yet we had an epidemic that was a behavioral health crisis. And it was going to require more than a single bill or a single program or, candidly, a single building. It was going to require an absolute transformation of everything we do, how we think, how we staff, how we serve, how we love. That is what Right Help Right Now has been and is all about. You see, people need to get the help they need right now. Not tomorrow, not next week, not next month, not next year. Now, today. Because too long is too late. And that's why this is so important. It's so important that we understand that it is services that are readily available. It is relieving law enforcement of the responsibilities that they have taken on, oftentimes to sit with Virginians for 50 hours, to decriminalize behavioral health crisis, to make sure that we understand that we need more capacity, we need more services, we need to meet Virginians where they are so that we can say to them, we see you. The system was broken. The system needed to be fixed. No Band-Aid, no quick resolution, but the entire system. And that's what this was all about. And so when Right Help Right Now was launched after 8 months of work where we had thousands and thousands and thousands of participants helping us understand how we could transform this system into something that would not just be good, but would be great, that would not just be a standard, but would lead the nation, would not just meet every Virginian where they are, but would meet them where they are now. That was the aspiration. And I have to say, friends, we stand here today cutting a ribbon on a facility that I think is so much more than a facility because it represents exactly that. Giving people the right help right now. We realized how important it was to have capacity. Capacity so that we could meet those Virginians where they are, so they could come to us. A capacity that was going to require an enormous amount of effort. 50 pieces of legislation were passed. 50. To my friends in the General Assembly, thank you for working with us. Every time we sat in a room and said, we need this, you answered the call. Thank you, thank you, thank you. $1.4 billion of funding behind Right Help Right Now. That's on top of what we already invest in behavioral health. $1.4 billion of funding, my friends. It's available because the Commonwealth is doing incredibly well. We're as strong financially as we have ever been, and we prioritized behavioral health as the top. What do we need to change? My friends, it is true transformation. We have seen access and capacity improve at an extraordinary rate. When someone needs help, they can call 988 today in a way they never could. 5 times the increase in responsiveness. Call numbers have gone from about 5,000 a month to 25,000 calls a month to 988. My friends, we are hearing you, we are seeing you, and we are helping you. When we started, there were only 36 mobile crisis response teams, and we said we need to get to 70. We are at 105 mobile crisis teams across the Commonwealth of Virginia today. 24/7/365 coverage, and the average statewide response time is now 42 minutes. We needed to have capacity for patients to get the care they need. When we started, there were 249 chairs in the Commonwealth of Virginia. And when this year finishes, we will be at 460, and we will be up to 775 chairs, which is an enormous increase in our capacity to meet patients where we need to meet them. 988 call centers, mobile crisis teams, hospital facilities, crisis receiving centers, pre-screening across 427 providers, and integrating 911 with 988 so that it can be dispatched at Virginians' needs. We've seen law enforcement officers that have been relieved of this time to a total since March of 14,000 hours. 14,000 hours returns to the citizens of Virginia, where our law enforcement heroes can get back into their communities, and that's just since March. That's 7 work years of time. This Prince William County Crisis Receiving Center is incredibly important. 3 main points. First, it is here to serve Virginians. 64 beds, 60 and chairs, 32 dedicated to children, 24/7, right here, right now. It also reflects what it takes to serve 24/7, 23-hour observation units. My friends, this is life-saving care. This is what this Crisis Receiving Center reflects. But on top of that, it is now representative of what we should all aspire to be doing, not just here, but across the Commonwealth and across the country. This facility is the national standard. Virginia is leading and demonstrating that we can transform behavioral health. We can meet Virginians where they are. We can serve our fellow human beings the way that God intended us to. In their most needed moment, we are there. And so finally, my friends, I hope that each and every one of you today feels an immense sense of accomplishment. When this facility opens, it will represent not just a Commonwealth's accomplishment, but a Commonwealth's heart. And that's why today I think is so important. And so I ask for God's blessing on this facility. I ask Him to bless everyone who comes in for help. I ask every person who works here, every clinician, every healthcare worker, every volunteer. I ask for His blessing on each of them. I ask for the bricks and mortar to be blessed. I ask for our law enforcement personnel to be blessed. Every time someone comes in here, I want them to feel a love that surpasses all understanding. And therefore we say together, amen. May God bless the Commonwealth of Virginia. May He bless each and every one of you. And let's continue to go to work, because we have to make sure that every Virginian gets the right help right now. God bless you all. Thank you.
Tall. Wait a minute. Not to come, but I said, sir, if I may, but I wanted to, I would be remiss if I didn't say thank you to my wonderful staff who helped me through this entire 5 years to get to where we are. I apologize for coming back, but it just, when you're doing these, you forget, but I wanted to say thank you to the staff. I also wanted to say thank you to the churches in the community that understands that there's a paradigm shift that they have to make to serve this community as it relates to mental health, as it relates to housing, as it relates to food insecurity. So to my pastors, most of you have 1, I have 7. But to my pastors of all the churches in this community, I thank you. Lastly, an entity, all of the stakeholders, the non-for-profit stakeholders, 93 of you. When I said, let's do this in terms of the community for mental health, voice stood up and everybody came. So I want to thank you for that. So you don't have everybody on the list, but I see you, you saw me. And then I want to come back and just close out by saying, for the Board of County Supervisors, I had you in my speech, but this was a bipartisan decision on the board. Didn't matter what democracy we're in, no, it didn't matter. We saw this as a need. And again, I just want to say to my colleagues, we can do all things. Who strengthens us in what we do? Doesn't matter the party. Look what you've done. Thank you.
Thank you, Governor Youngkin, Commissioner Smith, Chair Jefferson, Vice Chair Bailey, and Colin for your speeches and remarks today. Before we begin the ribbon cutting, I'd like to share a few directions and highlight some meaningful activities we've planned for you while you wait for the tour of this facility. In just a moment, I will invite our speakers and the Board of County Supervisors to gather in front of the ribbon. We also welcome the distinguished elected officials acknowledged earlier to stand at the ribbon cutting, and additionally invite representatives from NAMI, Trillium, Voice, Potomac Health Foundation, the Lions Club, Centera, UVA Health to join us in this special moment. Once the ribbon cutting concludes, we encourage everyone to enjoy refreshments and take time with one another. This is a wonderful opportunity for networking and for community building. And while you wait for the tour, we also invite you to participate in a special interactive experience near the cafe and resource table with the blue covering back there, the New Dawn mural. Here you'll be asked to write a personal message of commitment. Your words will become part of a larger collaborative artwork entitled The New Dawn Horizon. And this piece will be permanently displayed in the facility as a powerful reminder that each of us plays a role in helping others find light before, during, and after a crisis. And for those of you that participated in our dedication ceremony in May of 2023, you signed some canvases, which some art was added to by some of our participants at our Phoenix Center. And when you tour the youth and the adult CRC today, please notice to your right, hanging on the wall, those signed canvases of hope and wishes that have been decorated. This mural will be added to our walls as well. Facility tours will begin shortly. Our guides will lead tours of approximately 10 through each of the entrances, alternating inside so that everyone will have a chance to experience both the Crisis Receiving Center and Community Services Program areas. So please enjoy the refreshments, connect with fellow guests, and take a moment to leave your mark on the New Dawn horizon. Now I'd like to invite our speakers, board members, and distinguished elected officials and organizational representatives to join us behind the ribbon for the cutting.
We're going to cut this on 3. Ready? 1, 2, 3.